Mr. Kerr, ladies and gentlemen, I am very much pleased and honored for the kind invitation to be part of this highly reputable meeting. This is Khartoum, Sudan, and this is the junction between the White Nile and the Blue Nile. My name is Professor Fahal. I am a professor of surgery, University of Khartoum, Sudan. Ladies and gentlemen, I declare no conflict of interest in this presentation. All images were obtained after written informed consent. The Mycetoma Research Center, University of Khartoum, the main objective of this presentation to share the Mycetoma Research Center experience on mycetoma gained during the last 30 years. I'm going to talk in the coming few minutes on mycetoma as one of the badly neglected tropical diseases. I'm going to talk about the MRC activities, and I'm going to share with you some take-home messages. For those who may not be able to stay to the end of this presentation, I am going to conclude my presentation by saying at the Mycetoma Center, we are dealing with a unique disease, unique patients with unique problems. Hence, we need to have a unique solutions for these patients. Again, I am going to conclude by saying that mycetoma, it is a scar in the human conscious, and our job is to heal it because it is one of the non-glorious diseases. Ladies and gentlemen, mycetoma is a chronic granulomatous disabling disease characterized by massive deformities and destructions and lead to a lot of function loss. It can be fatal. As you can see, mycetoma is a disfiguring, mutilating disease. Mycetoma has many morbidities and it can be fatal, and as seen in this young chap. Mycetoma patients commonly present late with massive presentation. It frequently affects young adults, the most active member of the society. 30% of our patients are children, and you can imagine the misery of these patients and their families. It can be fatal in these young chaps, as this young chap who has a mycetoma of the cranial cavity. It affects the poorest of the poor in poor remote communities. The mycetoma patients are of low socioeconomic status, as seen in this young lady with a massive mycetoma, ended in amputation, and now she is coming to the clinic with this figure. A lot of them, they come from far away from the center with a very low socioeconomic status. And you can see how they are poor, these patients. The mycetoma patients has low health education level. They depend on local traditional treatment for quite a time before presenting to the center with a lot of morbidities, a lot of complications, and they come with a problem like this: massive secondary bacterial infection on top of ulceration. Mycetoma has many socioeconomic burden on patients, families, and communities. These are 4 members of one family, and all of them ended in amputation. And in underdeveloping countries, amputation is a social stigma. Mycetoma enjoys all the anti-disease characteristics: no social activities, drop of work, drop of education, and in fact it is a social stigma. It took us 3 good years to convince WHO to include mycetoma at the neglected tropical disease priority list. The Mycetoma Center now, it is a WHO collaborating center on mycetoma, and we had the privilege of the visits of the Director General of the WHO some time ago.
The Mycetoma Research Center was established in 1991 at Soba University Hospital under the umbrella of the University of Khartoum. It is a WHO collaborating center on mycetoma and is recognized globally as the world leader and an authoritative advisor in mycetoma management and research. The vision of the center is to continue as a world-leading center to lead the change in the mycetoma patient quality of life.
The Mycetoma Research Center journey is both long and interesting. We started as a small miserable room at Khartoum Teaching Hospital, and then we moved to Soba University Hospital with a meager infrastructure and facilities. Our staff that time were young and green with no training in mycetoma training and activities. In fact, we started with a zero budget. But at the start of this journey, in 1991, we had a very clear vision and objectives. Our objectives were patient management, conduct a super research and development activities, sound and objective community engagement events, as well as teaching and training. Concerning the patient management, now we got around 10,000 patients registered with the center. And this is a group photo for the mycetoma staff with patients at the front door of the center. We receive patients with advanced disease, as we are a tertiary center for mycetoma, and most of them, they come with a lot of complications and that may end in amputations. At the Mycetoma Center, you have a specialized cytology clinic for the diagnosis of mycetoma in a very short duration. Also, we provide this patient with a good quality ultrasound examination, and here is Dr. Mustafa is providing this patient with the examination. Further on, we provide our patient with free treatments, which is very expensive for the patients and their families. And you can imagine the amount of the drugs that the patient has to take at the journey with the mycetoma treatment. We keep good records of our patients. We provide them with all the information necessary for them to have a proper treatment and follow-up. This is our information unit, and all the information now are available online at the cloud site. Regarding the research and development at the MRC, we had established recently the Mycetoma Research and Development Arcade. And this is a virtual visit Along our journey with Mycetoma Center, we managed to publish more than 250 articles in highly reputable journals. Currently, we have more than 10 PhD students. And we managed to write the chapter of Mycetoma at Bel Allah Short Practice of Surgery. Currently, we have more than 23 research institutes, centers, and NGOs working with us on mycetoma research and community activities. Recently, we established the Al Hassan Center for Neglected Tropical Diseases clinical trial. Regarding the mycetoma community engagement, we have a good number of activities going on the center. The center is involved in many community activities. Considering the patient's low socioeconomic status and the difficulties they are facing to reach the center for management, we managed to establish 2 peripheral satellite units to deal with the patients and their activities and treatment. We conducted many field surveys, some environmental improvement activities, and has established the Mycetoma Friend Association, as well as health education events, and all that done under research and development background. Also, we were engaged in many activities with fine artists, musicians, and singers. We provide the patient with prostheses. We had appointed many mycetoma ambassadors to help to establish communication with the communities and the center. And recently we established the Mycetoma Vocational and Entrepreneurship Training Center site. We had engaged ourselves in animal cage development, presence in the social media activities. We have 2 satellite centers, as I mentioned, at Sinnar State and at the White Nile, and now we are working for the Jazeera area to have another satellite. And this is what UNSA Mycetoma satellite unit, Eastern Sinnar State, in collaboration with the Ministry of Health at Sinnar State. This is our team. The team consists of medical practitioners, surgeons, radiologists, theater attendants, anesthetists, as well as some of the artists and musicians and singers. They joined the mission to go from the center to the peripheral units where mycetoma patients are seen and managed. This is the journey to the center. We take with us all our surgical instruments, consumables, solutions. The patients are seen, screened, ultrasound examination is done for them, and the basic laboratory test is done before taking them to the operating theater. We have a lot of health education sessions for the patients and for relatives and other members of the community. We involve in these activities students from Sinnar University as part of their surgical training. We provide these patients with ultrasound examination by a mobile ultrasound machine, as you can see here. We provide them with all the necessary treatment free of charge. Again, we train the local staff from Sinnar Hospital on dealing with mycetoma patients. And this is one of the health education sessions going on involving the community member in dealing with the mycetoma patients and other activities. The roads are not always available for us, and sometimes the people have to use this vehicle to reach the center to be seen by the staff from the Mycetoma Research Center. The raining season in that area, it is very difficult, and it's very difficult to move from one point to the other point. This is the members of the community receiving the staff, helping us in dealing with our activities, and we enjoy very much the hospitality of the villagers and the head of the village. And you can see now the patient start to come to the clinic, waiting for surgery and other activities as well. And here you can see a lot of these patients are children. We managed to do more than 1,000 surgical operation free of charge for these patients. Again, this is the White Nile satellite unit. We started from scratch. We established the operating theater, and it was not an easy task. And here you can see the people trying to get water into the reservoir at the top of the operating theater. This is our operating theater at Sinnar State. I think it is a state-of-the-art facility with all the equipments, good anesthesia, and this is our mobile ultrasound machine, and these are our two senior radiologists, Dr. Rayah and Dr. Mustafa, and they had managed to do more than 1,500 examinations free of charge. We have a very decent laboratory at the village, and this is the wards, male and female, and we concentrate on our patients, in particularly the young children and young adults, so that they can go back to schools as soon as possible. And this is the operating theater at Wad Unsa village. We adopt as safety procedures, quality assurance procedures, this is the post-operative period of the young patients with their family. This is the patients, relatives, the villagers are expressing their thanks and gratitude for the team coming from the Mycetoma Research Center. We have a telemedicine facility at the village. You can see this is one of the technicians operating the telemedicine facility there. So we can be in contact with the patients and the relatives when we are not there. These patients, they come late with advanced disease, and many of them, the only option will be amputation of the affected parts. They have a very poor quality procedures, and they have a lot of amputations at different sides of the body. We managed to move a mobile prosthesis workshop from Khartoum to the village. We provided them with 160 prostheses. Some of them had bilateral prostheses, and many of these young ladies has free prostheses that had changed their life. The environmental condition in these areas is poor, and you can see a lot of children are moving barefooted in direct contact with the soil, which is infected with the organisms that cause mycetoma, in direct contact with the animal dung, thorn, sharp objects, and all these will facilitate the introduction of the organism into the subcutaneous tissue. To improve the environmental conditions, we have 3 activities. Obviously, health education, animal cage construction, and we have environmental hygiene activities. And this is one of the engagement of the people at the community on health education activities. As a mass group or as a small group with a focal group discussion. We go to the schools and meet the students and talk to them about mycetoma and how they can avoid getting the infection. Regarding the animal cage, actually it is enclosures made of thorn and wood. And this is an important cause of introducing the infection to the subcutaneous tissue. We managed to construct more than 70 modern animal cage. And that had improved the environmental condition in one of the villages and had reduced the incidence of mycetoma there. Regarding the hygiene of the villages, we managed to include the villagers in improving their own local environmental conditions. The villagers took an active role in cleaning their village and removing the rubbish and the dirt and the soil. We conduct several field surveys for early case detection, management, health education, and socio-economic support for these patients and the communities. We started these activities quite a long time ago. The first one was in 1994. And these chaps were a medical student that time, and all of them now are a senior consultant in different specialties. For early case detection, we do house-to-house surveys, seeing the population, do clinical examination for detection of early mycetoma lesions. We record the finding in the CABI. This is electronic computerized database system where the patient demographic features were recorded, the lesion is photographed and the area it is photographed as well, and the coordinate was recorded as well, and send it to the server at the Mycetoma Research Center for analysis. We managed to see a patient there and refer them to the center at Onsa or the Khartoum, and we managed to see patients with early lesions, and which is a very good plus for the good management of these patients. We had a lot of health education sessions in these surveys, focus group discussions, house-to-house surveys, and education for the families in these houses. The Mycetoma Center is in charge of the National Mycetoma Control Program. In collaboration with the Ministry of Health, we provide these patients with some social and economical support, and here you can see a distribution of some shoes. We engage in these activities artists, singers, photographers. They go to schools, going to schools, talking to the students, and even they have an open drama activities with them. We conducted many training for nurses, health assistants, young doctors at the Mycetoma endemic areas. We involve with us the local authorities, and here is the Minister of Health at Sinnar State, addressing these training activities. With Sinnar State, we managed to produce a good amount of posters, leaflets on Mycetoma. And here, this is some of the leaflets on Mycetoma activities, photos, posters, and some videos as well.
شفت الحكيم شايل المقص والمشرط، خفت قام طمني. سمعت إنه العلاج بقى بالمجان، فرجعت تاني المركز. وصلت في العلاج لحد ما حالتي تحسنت والورم اختفى، وقدرت أكمل دراستي الجامعية والحمد لله بقيت كويس.
We have a very active, dynamic website, the mycetoma.edu.sd. We have presence in the social media, Facebook, Twitter, WhatsApp, and others. This is one of the famous singers in Sudan. He is one of the Mycetoma ambassadors. Engage with the community in one of the Mycetoma endemic regions. Again, we established the Mycetoma International Consortium as well as the Mycetoma Working Group in collaboration with many international bodies and individuals. We are engaged in many of the community activities with the stakeholders, talking about how we can improve the quality of life for these patients in the remote communities where Mycetoma is endemic. The center has appointed several ambassadors to execute the Mycetoma Research Center objectives, visions, and activities. We are involved with many celebrities, singers, writers in Sudan to deal with the Mycetoma issues and activities. And this is the top celebrities in Sudan visiting the Mycetoma Center, singing to the patients and to the relatives. We established a group called We Are With You. Again, this is a group of 40 top celebrities in Sudan, where they are involved with us in advocating for Mycetoma issues, improving the health education activities. We have organized several exhibitions for photography and for paints and portraits, dealing with Mycetoma issues and activities. We organized the Mycetoma Cultural Week in collaboration with the French Institute at Khartoum.
Grâce aux efforts constants du professeur Ahmed Fahal. L'Organisation mondiale de la santé a fini par considérer le mycétome comme une maladie négligée en 2016.
Recently, we established the Mycetoma Vocational and Entrepreneurship Training Center site. This is as one of the unique solutions for mycetoma patients. The mycetoma patients may end in amputations, massive deformities, and destruction of the tissues. The aim of this center is to train them on some vocational activities and to provide them with entrepreneurship training so as they can go back to the community as an active, productive members. And this is the center, and the center provides these patients and their relatives with training in different activities: carpentry, gardening, bakery, and other activities. And then they put them in contact with banks and businessmen so they can start a new life, active member of society. We had established quite a long time the mycetoma patient support associations to help the patients to deal with their daily activities, supporting them to get their medicines and to support their transportation to the center and other activities, as well as the prosthesis. I have to say, we started these activities with a zero budget. Ladies and gentlemen, I would like to say that with a clear vision, a smart objectives, and a very logical methodology and a good communication, we came with a very good, unique solution for these patients. We need to have a good communications. We need to work together, and we need to have a teamwork of different disciplines, of different backgrounds, so that we can have a good outcome for the patient's management and care. Together we can do a lot of things, a lot of activities. At the end, I would like to acknowledge the activities done by the mycetoma pioneers in Sudan in the past, our recent and present collaborators, supporters, and a special thanks to the Mycetoma Research Center team at Khartoum. And again, I would like to thank you very much for your kind attention and the invitation to be part of this highly reputable meeting. And this is our contact. And thank you very much.